The pathway for mental health care for adults receiving dialysis was set in motion in 2016 when both patients and clinicians identified an unaddressed need for support with mental health concerns. In 2020, leadership from the Kidney Health Strategic Clinical Network and Alberta Kidney Care identified mental health as a priority and asked for support to develop a mental health care pathway. In January of 2021, a survey was sent out to dialysis patients asking about whether they would consider receiving mental health support in dialysis care. 60% said yes. Funded by the Kidney Foundation of Canada and co-led with a community advisory committee, we developed and tailored a person-centered pathway for mental health care for Albertan adults receiving all forms of dialysis. The pathway for clinicians was developed with evidence from literature synthesis, surveys, focus groups, and interviews, culminating in a consensus-building Delphi exercise in 2024. A patient-facing version of the pathway was created using a collaborative, co-design approach with the community advisors as partners. This was the prep work. In 2024, funded by the CanSolve CKD network as part of Mind the Gap, we turned our gaze towards implementation. The pathway then needed a matching practice direction document, or PDD, for nurses. Both the PDD and pathway address 7 sections: initial conversation, screen, follow-up on suicidal risk, urgent referral, management, and documentation. Initial conversation. An initial conversation can be started by the adult receiving dialysis or the kidney care provider, focusing on the person's mental health or how they are coping with dialysis as part of the ESAS renal. Screen. Further information can be gathered by inviting the person to interpret responses to the ESAS renal in a conversation together. If there are any concerns about depression or anxiety, the PHQ-9 or GAD-7 are 2 tools that can provide more detailed assessment. For more information about the ESAS renal, PHQ-9, or GAD-7, view the Assessment Tools overview video. Follow-up. Follow-up will differ based on severity of symptoms of depression or anxiety. If symptoms are minimal to mild, continue assessment at the next supportive care assessment and provide freely available mental health resources. If the symptoms are moderate to severe, provide resources and discuss referral to a primary care provider. If the patient does not have a primary care provider, the patient or healthcare provider can call the Mental Health Helpline 24/7 or notify the nephrologist or dialysis NP. Discuss potential referral to a dialysis social worker, spiritual health practitioner, or psychologist. Continue assessment and ask about follow-up with a primary care provider or mental health helpline if applicable. Follow-up on suicidal risk. Question 9 of the PHQ-9 asks the patient if they have thoughts that they would be better off dead or of hurting themselves in some way. If the patient answers anything other than never, ask them to complete the Columbia Suicide Severity Rating Scale. If not at high risk of suicide based on the Columbia, complete a personal safety plan form and with consent, refer to a social worker or psychologist if available. Urgent referral. If the patient is high risk for suicide, notify the most responsible health practitioner and ask, "Are you willing to go to the emergency department for assistance?" If the patient is willing to go to the emergency department, arrange for the patient to get there or refer them for an emergency psychiatry consult. If the patient is not willing to go to the emergency department, the most responsible health practitioner will complete a Form 1 and take steps outlined by the Mental Health Act and call 911. Management. Resources and suggestions regarding non-pharmacological options can be provided to patients for symptoms of depression, anxiety, and general coping skills. Pharmacologic treatment is also an option after a diagnosis for depression or anxiety has been made. Documentation. As always, document in the patient's health record. For example, note the outcome of discussion, resources provided, or any interventions taken.